Positioner, I have it.
Okay, good.
Good afternoon. And today we have a pleasure of interviewing my patient who I'm so proud of. He's a composer and playwright. And we're going to have a conversation. What does it mean to have a severe sleep apnea, insomnia, and have a treatment with oral appliance? And thank you very much to my audience. If you have trouble sleeping or sleep next to the snoring partner who doesn't have any treatment, this program is for you. And if you're a medical professional who, just like me, passionate about sleep and breathing, this program, through the very creative and talented patient eye, will help you to connect the dots and maybe include oral appliance therapy into your armamentarium. So I'm going to talk first how we met. So Oded, I'm very proud. He's my patient, and on his first appointment, after we discuss intricacy of treatment for severe obstructive sleep apnea and insomnia, he sent me the email with a song he wrote about me. So that's really made extraordinary impression, and thank you very much for that. I was very much touched, and it was more than 5 years ago, right? Around 5 years ago.
I believe so. And how could I not write a song about someone who has so changed my life in such a wonderful way?
Well, thank you very much. So, first of all, I want to mention about a recent accomplishment for Oded, in addition to being a talented composer. And you can check his music on Instagram using the account Oded Gross Music. Follow him on Instagram and listen to his songs. Recently, he wrote the Playwright called Harmony. And somebody else who I highly respect and always use his creativity to elevate my mood, Steve Martin, was on that play, and he has a lot of positive comments about the work Oded did writing Harmony. So thank you very much for giving me the opportunity to learn about William Shakespeare more and see the intricacy, how several plays can interact together and all the heroes. So that was really great. And it's still in my mind. I'm trying to understand a lot of language. You use a wonderful language in that play. And of course, I'm happy what Steve Martin was in the audience and what he liked the play as well. So let's go back to your treatment, Oded. Can you please tell us how that's all started?
Yeah, so I don't remember the exact year, but I want to say it was somewhere between 10 and 15 years ago. I was my wife I was snoring horribly, and not only snoring at night, but I would wake up with these choking, what sounded like choking fits to her. I would snore, I'd go quiet, and then I would wake up in a burst of sort of choking. And apparently I was doing this all night and didn't even realize it, and was incredibly tired all day. And suffice it to say, I was diagnosed with severe sleep apnea. And I was given at that time a few options. One of them was a CPAP. The other was the surgery. And for some reason, I opted to do the surgery. The surgery is a UPP surgery. They removed my uvula, they removed my tonsils, and they raised my soft palate. They also fixed a deviated septum in my head. Following the surgery, I was a silent sleeper. So we had assumed that the surgery was a success. And I assumed that for over 10 years. And for part of that 10 years, it might have very well been a success. But 10 years, 12 years later, I went to another doctor because I still had these pulmonary issues as well, which is the other thing I deal with, where I'm coughing all the time, and which they had assumed was related to asthma or allergies. But this specialist said, it's not asthma, it's not allergies. We've tested you on both. You should do another sleep study. And I said, why? I had all this surgery. And they said, yeah, that surgery has been proven to not be effective over the long term. I don't know if it's scar tissue that sort of grows back and sort of makes things worse again. Long story short, I got tested, another sleep study, and I still had severe sleep apnea. So that was an incredibly depressing discovery. Following that, and I should say that the sleep apnea that I have impacts my coughing a great deal, which I did not know the two were related, but apparently sleep apnea apparently makes this pulmonary issue that I have, it exacerbates it. So I had some options then. Obviously, surgery was not an option, but I went on a CPAP for a while, for a few weeks. I tried it out, and I was very uncomfortable sleeping with a CPAP. Not only am I someone who has sleep apnea, but I suffer from just having trouble sleeping, falling asleep. I'm fidgety at night. I can't get out of my head, and the CPAP was just sort of making that condition worse. So the other option after trying the CPAP, the last option really at the time, was to look into an oral appliance to see if it would help, if I was a candidate that it might help. And that's what brought me to Dr. Sokolinas, thank God. And I've since had an oral appliance made, and I've had another sleep study done now with the oral appliance. And what that result was that my sleep apnea went from severe sleep apnea to mild sleep apnea. And more significantly, my oxygen level at night was normal, where it had not been. And that's important because obviously it's the lack of oxygen that you're getting in the night that sort of leads to, and you correct me if I'm wrong, Dr. Sokolina, all the bigger issues, heart issues, diabetes, all of those issues that sort of can come from sleep apnea. We don't want them, and they're all related to the amount of oxygen. So I would, to me, that was a phenomenal improvement and one I could live with. I've also, I have to keep my weight down. I mean, I choose to keep my weight down because it also helps. I find that when I have less weight around my neck and face area, I sleep better. So I try to keep my weight down, and my sleeping has been pretty good. Listen, I still deal with. I'm a playwright. Anytime I have anything opening, I'm anxious and I don't sleep for a week. I can't get out of my head sometimes. But when I am sleeping, I'm sleeping well and I feel rested in the morning, and that is fantastic.
Yeah, well, that's a nice story, but I want to do a couple comments for my audience. What that story with the severe sleep apnea, a lot of people looking for magic wand. They want to get the surgery thinking what that's gonna eliminate all the symptoms forever. But as we know, nothing lasts forever. And if you're looking for magic wand and somebody convince you for UPP surgery, which is not that often because that's proved to be unsuccessful, but if it happened with you in the past, please do another sleep study, because silent sleep without snoring does not mean that you don't have sleep apnea. And that is a live representation of that story. And another thing I want to mention, what a lot of people with a severe sleep apnea, in addition to that severe sleep apnea, they also have insomnia. And CPAP machine is an extremely challenging treatment for that. And
I mean, just to bring that point home, after the surgery, I was a silent sleeper, but 10 years later, and my weight fluctuated, within 30 pounds. I've always been a silent sleeper, even though I still have, prior to getting the appliance, I still had severe sleep apnea. So the fact that I wasn't snoring made me assume that I was cured, but I wasn't cured. It just cured my snoring. It did not cure the sleep
apnea.
Yeah.
Yes, that's a very good observation. But before we start talking about oral appliance, I would like you to share with our audience, what do you use on everyday basis to monitor your oxygen level, just like you mentioned, it's very important because oxygen level or fluctuation or drop in oxygen level can lead to a lot of complications. It can break your heart and it can break your brain. So
So
what do you use?
well, I got it. I only wear it at night, but I got the Aura ring because it checks your oxygen level. Listen, I'll be the first to admit that I don't know how accurate these things are. I mostly look for trends. I know the new Apple Watch also can test your oxygen level. I like the ring because it's it's not I don't want to sleep with my watch on all night. And when do I charge it? There's other devices. I'm not an advocate. I'm not trying to sell a product here.
No.
But the Aura Ring works for me. I wake up every morning. I check how many hours it says I've slept. It tells me the kind of sleep, deep sleep, REM sleep, light sleep. And it also tells how much movement I did. And it also tells me a little bit about the percentage of my oxygen, the way I presume a oximeter would. And usually it's around 98%. And that's what I like to see. I'm hoping it's relatively accurate. If it goes down a few points, I know I better check with my doctor.
Yeah, no, that's a great thing. So now I want to go to the oral appliance treatment. You might, several people who have different designs of the oral appliance. So first of all, I would like to ask you what changed when you got your first oral appliance, which look like this, and you have one.
I have one
What
just like
changed? What changed in your sleep when you got your oral appliance?
Well, I mean, I was sleeping. I think the quality of my sleep is what changed most significantly. I was sleeping. I don't want to say I was sleeping through the night, but whereas I was waking up, I don't know, dozens, 50, 60, 100 times, in an hour or some crazy number like that, that was no longer an issue. So even though I still have at times trouble getting out of my head, when I am sleeping, which is usually somewhere around 6, 7, sometimes if 8, I don't think I've ever slept past 8 hours in my life. And those are rare times. But when I am sleeping, I feel like the quality of my sleep is better. I'm less tired in the day. I have a little more energy. Maybe it's a bit of a placebo, but I also feel like because I see that I'm getting the oxygen I need at night, I just feel healthier. I feel stronger. I feel a little safer day to day. So prior to that, I mean, I would be in my car at a stoplight and I would get really like, I want to go to bed. That's scary to be in your car and fall asleep. And anyway, so vastly improved, energy, sleep. I was having more dreams, which was great.
For creative purpose.
Yeah, I mean, for if you're a creative person, dreams are critical, So
Yes.
Yeah, it was a big success for me.
Yeah, but tell me the comparison between your old appliance and now you have a very thin nylon printed appliance called Sirena. So tell me the difference between those two.
Well, I mean, the big difference is just the amount of space it takes up in your mouth. I mean, when I used to wear this at night, it was not discreet. It's not a particular. Listen, there's nothing sexy about any of these appliances.
But it's sexier than CPAP.
It's definitely sexier than CPAP. I give hats off to my wife who looks at me every night and still likes me. The new appliance, this thin white one, is so much more discreet. It feels lighter in your mouth. It weighs substantially less. And yeah, it's just a snugger fit. Overall, I think it's a fantastic improvement. Sometimes the rubber bands are a little bit harder to get on because it's such a much smaller appliance. you have to be a little bit more, I got big fat fingers, so it's hard to get the rubber bands on. Whereas the old appliance, it was a little bit easier, but the old appliance was just so bulky that this one is definitely an improvement. I'm happy that I got it for sure.
Thank you very much, Oded. We're so happy what you can express, like real life story, life with the severe sleep apnea and insomnia, and how oral appliance improve your life. We really appreciate. I think your interview going to be so encouraging and useful for a lot of my patients and some other patients as well. And we wish you to write a lot of more plays now with the great sleep you're getting, and compose a lot of music. And you can check again the music or new news about Oded Gross on his Instagram, Oded Gross Music, on that account. And we're looking for more beautiful plays. Thank you.